is the August version of the Simply Well Seniors Aging Well Seminar Series. We're here at United Methodist Church in Leominster, as we have been all this year. It's been a great venue. We do have some air conditioning. It's
1 out of 4.
1 out of 4. So, to introduce ourselves, I'm Jeff Turcott.
Kelly Kurtz.
And we are a husband and wife team. We're realtors, but we're different. Our business is Simply Well Seniors, and our tagline is helping seniors navigate the journey to the next place they call home. And we've been very busy. Yes?
Can't hear.
Can't hear? So like I was saying, Kelly and I have been busy. We've had a busy summer. Things are coming to a close at the end of this month. We have, how many? 1, 2, 3, 4, 5 closings this month, and it's been a lot of work. So it's been great though. We also moved 2 folks that were in different stages. One couple that we worked with for over a year and a half, finally got them settled and comfortable in their new living at a community in Nashua, New Hampshire, which was a fantastic outcome for them. Mm-hmm. So that was great. So we want to introduce our sponsors. So I know that one of our sponsors came in on 2 wheels, and we delayed as much as we can. Christy Livingston of Heywood Wakefield Commons, if you'd like to say a couple of words about Heywood Wakefield.
Good morning. I'm Christy Livingston from Heywood Wakefield Commons, assisted living community in Gardner. And we're a proud sponsor of this series with Kelly and Jeff. And we're an assisted living, and we do things a little different where we have affordable options for our seniors. So anybody who moves in doesn't have to worry about what happens if their funds run out. But something I want to mention, today we have a special thing going on in Gardner. So if anybody's hungry later and they don't mind going to the Gardner area, we're doing a fundraiser for the Alzheimer's Association. And today, if anybody mentions Alzheimer's or Heywood Wakefield Commons, and I actually just put some flyers for this on the table in the back, 20% of any order today at the Gardner Papagenos / D'Angelo's will be donated directly to the Alzheimer's Association for a great cause. So again, I have information at the table at the back. So I just wanted to mention that. So thank you.
Thank you, Christy. And we have a new sponsor as well, the Gables in Fitchburg. And Patty, if you'd like to say a few words about the Gables.
Good morning, everyone. I'm Patty Peterson. I'm the marketing director / community liaison for the Gables Assisted Living in Fitchburg. We are a family-owned, all-inclusive for care assisted living that was formerly a 55 plus. So we have regular apartments, and we also offer an independent, enhanced independent option if someone doesn't need help with their daily activities and still want to enjoy the other amenities of assisted living. So we have regular apartments with full galley kitchens and balconies. So if anybody has any questions, I'll be around later.
Thanks, Patty. And Christy and Patty will be around after as well. And I want to always mention our video sponsor, NXT Level Studios, Medora Photography in Leominster. And Keith is here and has been with us from the very beginning. And putting
Fitchburg, actually. They're in Fitchburg.
Fitchburg, sorry.
Yes.
And putting together these videos for us so we can post them on YouTube and share them forever, basically. Just to remind you what it is that we do, and we were just on a conference call with an organization that was putting together an online community for recently retired folks. And these 2 young women were actually recent graduates, master's
MBAs from Harvard, and we did a really great Zoom call with them, and they're really working on a whole network for seniors and from a technology standpoint, setting up a platform. So it's a really great call to talk to them about different resources that we offer and things that folks are looking for. So when we know more about her platform, we'll share that information with folks because it sounds really up and coming. and two smart girls from Harvard.
Very
so.
smart. Yes.
Yeah.
So but it was interesting to explain to them what we did, and we honed our message enough that she actually, gave the feedback to us that, oh, you're soup to nuts. I said, yes, we are. We'll take care of everything. So from downsizing and decluttering to coordination of vendors, estate liquidation, junk removal, to the sale of the real estate. We are realtors, as I mentioned earlier, to coordinating with a moving company and move solutions. And that's what we helped the recent folks that we moved in June with this entire package, and it worked like a charm. So
we've also helped folks move into or out of both the Gables and Heywood Wakefield Commons. So great communities to check out if you are not familiar with them. They're all different, but they all have something unique to offer. So we always encourage people to check them out while you're healthy and vibrant and ready to go, so that should you need services or need to consider a move, you've already explored your options.
So without further ado, I'd like to introduce our expert for today, Russ Swallow. We met Russ in his office, also known as Panera Bread, at in one of the booths. And Russ, has Panera Bread caught on yet? Are they charging you rent, or is
I get free rent.
You get free rent
and all the coffee I can drink. And is this working?
Yes.
And it only costs me like $10 a month for all the coffee I can drink. And some of the naysayers will say, "Well, isn't that the unlimited coffee program?" And I say, look, I can rent space in all of these places for $10 a month, and that's sounds better than I'm getting, unlimited coffee.
That's pretty good. So let me pull up your slide presentation, and then we'll give you the floor.
One thing I wanted to say to begin with, when you signed up for this, the form on the internet said there'd be a panel of experts here today. I'm the panel. So Medicare can be confusing. So a lot of people start here. What do you do? Well, I really want to, before we dig into the nitty-gritty, Medicare, how long has it been around? Before 66, there was none, zero. This was the first application. It was pretty simple. If you want to check yes, if you don't want to check no. It costs $3 a month. And there's the first guy that had a Medicare card. Some of the kids might not know who he is, but I think everybody in here knows who he is. And there's the first signing ceremony with him and LBJ, signing the application. That's what it looked like for 40 years, but before 2006, there was no drug coverage. Here's what the card looks like today. Now, let's get into explaining it. This guy is totally confused. I mean, he got that handbook in the mail, Medicare and You. It's got great information if you know how to use it. But then his mailbox looked like this. And then he started trying to read all this stuff. So he said, well, I never can get through any of that or all of that. So he went out and bought Medicare for Dummies. Now, he has no clue. He has too much information. Doesn't know how to put the pieces together. So Medicare's got a lot of moving parts. And the bottom line is choosing between one of two of them. On the one hand, we have a Medicare Advantage plan, and we're going to go into details about all these plans in a few more slides. But rather trying to work Medicare Advantage into our vocabulary, I just call it the apple. The other choice is Medigap and a drug plan, which is the orange. So what we're talking about when we're comparing plans, we're talking about the apple to the orange. So here's how and this goes hand in hand with the handout I had there. Medicare Advantage is an HMO or PPO, and Medigap has got a separate drug plan. Over here, the Apple, you got deductibles and copays, and you got to go to network doctors. Even if it's a PPO, it's PPO network doctors. Over here, what I have is virtually 100% coverage. I can see any doctor and hospital in the country that accepts Medicare. Over with the Apple, I'll probably need a referral to see a specialist. And these plans will include some extra stuff. Over here, we don't need referrals. If I had an issue and I needed to go to the Cleveland Clinic in Cleveland, I could go there. I wouldn't need a referral. I'd still have 100% coverage virtually. And they don't have free stuff, but some of them have discounted stuff. Medicare Advantage will cover you for urgent care or emergency care anywhere in the country. With the Medigap route, with the orange route, I have all care. The Apple plan, my wife has that. She has a 0 premium. And we'll explain why it's 0 a little later. Now, she's got deductibles and copays. So I call it pay as you go because it's a 0 premium, and I'm going to explain that later. You got a 0 premium, so as you use it, you pay as you go. Over here is my plan. My plan is not free. But with my health issues, if I had Linda's plan, I see a lot of specialists at $45 or $50 for copay. And these specialists are nosy people. They want me to have all kinds of tests, duplex carotid, MRI. So if I added all that stuff over the course of a year, I might spend $200 a month or more. So I opt for this plan where I've got virtually 100% coverage. And where do I want to spend the $200 or so? In copays or have it paid for? So I call that prepaid. Now, if you haven't enrolled in Medicare, there's 3 ways to do it: online, by phone, or in person. I would try to say, try the phone first. It might take an hour for somebody to come on. Hopefully they're getting better. And you can enroll online with them. And when we talk about enrolling online, there's 2 parts of Medicare that we're going to get into. Part A is hospital and Part B is medical. Or you can go to your local Social Security office. Don't go to the one in Worcester. That would be an ordeal unless you had an appointment ahead of time. So the initial enrollment period lasts for 7 months. 3 months before you're 65, the month you're 65, and 3 months later. If you sign up in the 3 months before, your Medicare coverage starts your birthday month. If your birthday month is the first of the month, everything starts a month earlier. And when you turn 65 or the 3 months after, your coverage begins the first of the next month. Your card will be emailed to you once you're enrolled. And I call this Medicare card your ticket of admission to access the other plans. If you don't sign up for Part B when you're first eligible, you could get slammed with a penalty for the rest of your life unless you've been covered by a group health plan. So That's it. If you sign up later, you need 2 forms. You need a form to enroll in Part B, and you need a form for your employer to fill out to say you've been covered by Medicare since you were 65, and that wipes out any possible penalty. There are special enrollment periods. There's 25 of them. If you don't fit the first ones we talked about, I'd try to see if you can fit another plan. So I talk about original Medicare. This is what you sign up for. Part A is hospital. Part B is physicians and outpatient. Yeah, I went to that school too. A long time ago. Part A hospital, it covers where you're in the hospital, any surgery, you get nursing care, lab, some home health, and at the end of the road, Part A pays for your hospice care. That costs almost $1,700. There's a deductible on that. And it starts when you're admitted and 60 days after you come out. And if you have multiple admissions separated by 60 days, you might have multiple $1,700 deductibles. That deductible covers your copays for the first 60 days. Hardly anyone is in longer than 60 days, but if you're in longer, the price goes up. It'll cover you for rehab in a nursing home. That's called a SNF, a skilled nursing facility. And the first 20 days are free. If you're in longer, the price goes up. To get to skilled nursing, you have to have been in the hospital for 3 days. And you go for the rehab within 30 days, and your physician says you need the care. And it's got to be approved by a facility, and it's approved by Medicare. Here's what Part A costs. I think most of us can afford a zero premium. So if you paid into Medicare for 10 years, there's zero premium. If you paid, it didn't work that 10 years, the price would go up. And I only see this occasionally. That's when the kids brought mom and pop over from the old country and they hadn't paid into Medicare. Part B, medical. Clinical research, DME. One of my sons has sleep apnea, so he has one of these CPAPs. That's considered DME. Ambulance, some outpatient. Like my good friends will tell me they think I need a frontal lobotomy. So you better believe what I'm going to do. I'm going to get a second opinion. The plan has, this is for Part B stuff, a $257 deductible. When I say I've got virtually no copays on my plan, I'm calling $257 virtually nothing. Now, if I only had the original plan, Medicare would pay 80%, then I'd have to pay the remaining 20%. It's got to be necessary. Preventive stuff is free, usually. And it covers doctors, outpatient, ambulance, DME, and mental health. There's a cost for Part B based on your income. For 2025, if an individual is making $103,000 or less, or if you file, $106,000, if you file jointly, it's $212 or less. That monthly premium is $185. If you make more, the price goes up. I've got one couple that are squawking about paying $630 for their Part B. They're really squawking. His only problem is he makes $1 million a year. And, those are the first to complain. Now, I retired last year. I'm not making the big bucks. Well, if we go back here, you'll see the Part B costs were based on the income I made 2 years ago. It ratchets up every year. So in 2026, it'll be what I made in 2024. So I'm retired. I'm not making the big bucks anymore. There's a form you can submit to Social Security based on 8 life-changing events. And then they'll reestablish what you have to pay for Part B, or the income that you'd be used for calculating that. Mortgage, marriage, divorce, death of a spouse, I stopped working, work reduction, you lost your rental income, you lost your pension, and part of your income was a settlement, a retirement settlement, which you only got that once, but it showed up 2 years ago. So the next question we get always talks about drug coverage. And as we go through this, anybody a question, raise your hand at any time and I'll answer it. We don't have 300 people in here. The apple includes the drug plan. The orange, it has to be separate. These plans have a deductible stage. These plans have a deductible that can be up to $590. Some plans have no deductible. Some plans have a deductible for, a copay for the generic, preferred generics and generic drugs that have no copay. So you either pay the copay, or if you didn't have a copay, you then move in to the initial coverage stage. And when you're in that, you pay 25% of the retail cost or whatever the copays are. And once that total money has approached $2,000, you get 0 payments for the rest of the year. Now, if you're taking generics, that's no big deal because you'll never get anywhere near that. But if you're taking some of the stuff like I take, you'll get up to more than the 2,000. And if you're taking these expensive meds, for the first of the year, you might pay the full 2,000 sort of up front. But in 2025, they came out with a Medicare prescription plan or payment plan, and it spreads the cost out over 12 months. So if you're watching your budget, the beginning of the year, you might pick this plan, especially if you think you're going to die soon. All of these plans have a drug formulary. So what's a formulary? I'm glad you asked that question. It's a list of the drugs that are covered by each plan. Different companies may have different plans. The plans do not have to insure every drug, but they must include at least 2 drugs in each therapeutic category. Always get generics. Anybody here know what GoodRx is? Some may not. Well, let me explain this. I had cataract surgery, 7, 8 years ago, whatever it was. And after each, I'm holding this in the wrong place. After each eye, they give me 3 different eye drops, a little tiny tube. Tube 1 cost $17. Tube 2 cost $27. Tube 3 cost $84. $84 falls into a special category, a NW category, meaning no way. And if you're a friend of mine, I might use an adverb between the N and the F. Low-income people might be able to go through a website called Needy Meds, because some of these pharmaceutical companies have foundation companies that'll give you a break. If you're a veteran, get all your vets from the VA, unless you would like to be able to go to one just around the corner when you need it. And the state of Massachusetts has a plan called Prescription Advantage based on your income, where that'll lower the cost of your drugs. Let's talk about the apple. The apple includes Part A, hospital, Part B, medical, and it also includes a drug plan. And it gives you some extra stuff. These plans are either an HMO, where you need to see a network doctor to get a referral, or it's a PPO, where you can go out of the original network, but the PPOs also have their own network. So if you can't find it in either network and you have to go elsewhere, the physician you're seeing would have to accept the terms of the plan's payments. This gal was confused. How can it be a freebie? I'm glad I asked that question. Medicare pays private insurance companies $1,100 a month. You no longer have original Medicare, you have an Apple plan. And that Apple plan will replace what Medicare may have spent if you just had original Medicare. In other words, you don't have the $1,700 upfront to the hospital. You don't have to pay 20% for your doctors and outpatient. And I had a friend of mine say, why are more and more people opting for a Medicare Advantage plan? And my answer was, did you ever hear about the baby boomers? There's more and more of them every day. And the more and more of them are deciding to go with Medicare Advantage. Pretty simple explanation, but you have to think about it. 10 or 11,000 people a day reach age 65 in this country. Here are the extra benefits you can get with the Apple plan. Dental, but it's not like the dental you have. They probably have their own dental network. And if you've been seeing a dentist for some time, I can virtually guarantee you that your dentist is not in that network. One of the insurers, if you fit, and I'm not going to mention insurance names because this is an educational session, and if I started talking about different companies, it would be a marketing session, and then I would have to have Medicare approve every one of these slides. And if somebody raises their eyebrow while I'm doing this, I might tweak it to cover that objection before it occurs. If that was the case, if this was a marketing program, I'd have to get Medicare to approve that slide. Ain't no way I want to do that. So this is strictly education. Cover hearing, over-the-counter drugs, eyeglasses, and maybe silver sneakers to join a health club. These plans will cover you for urgent care or emergency care anywhere in the country. Some of them, not all of them, one of them I know of has what they call snowbird coverage. You can see the network doctors in Florida, Arizona, and pay like you were just the co-pays as they were in network here. Yeah.
So the question I have, maybe go back a couple of slides when you were talking about these Medicare Advantage plan, who who administers these plans. It's the
insurance company. Didn't I say
insurance
that?
companies. Private insurance companies administer
They're
these
paid
plans.
to administer the plan.
Okay. All right. So you have a choice.
No, if you switch to a Medicare plan, East Podunk Mutual is now your insurance company, and Medicare's out of the picture.
I see. Okay.
Here is the orange. Every doctor and hospital in the country that accepts Medicare. You'll need a separate drug plan. We said that up front. The way these Medigap plans work, like I use UMass. So I go to UMass for whatever it is. UMass has got my insurance cards. They bill Medicare. They bill Medicare $10,000 for a toothache. All right. They send the bill to Medicare. Medicare pays whatever their established rate is, and I think $10,000 is too much for a toothache. So Medicare will pay 80% of the billing that they amount, and then they send the 20% to my Medigap plan. The Medigap plans have no choice. They've got to pay the 20. That's part of the deal. Now, all of these Medigap plans, no matter what the insurance company is, they all have the same benefits. They're mandated that way by Medicare. In Massachusetts, we have 3 plans. We have the El Cheapo plan that nobody wants. Then the plan called Medicare Supplement 1A. And the one, there's not a whole lot of difference, but you can only apply for that if you turn 65 before January 2020. So the only difference between the plans really so much is cost. So my wife has got the zero premium plan, and then her health tanks. So she can switch to the plan I have without any evidence of insurability and paying the same premium I have. Massachusetts is only one of 4 or 5 states you can do that in, like Massachusetts, Connecticut, New York, and I think I forgot. But if you live in one of these other states, if you want to switch from the apple to the orange without any potential challenges, you can only do that in 6 months. After that, you can still move, but you have to fill out a health questionnaire. And, depending on your health at that time, they might not insure you, or they might jack the premium up. But we don't have to worry about that in Massachusetts. Everybody hears about is Social Security going broke. And then they also say, what about Medicare? Is that going broke? No, it won't go broke. It's complicated. Right now, people working pay 1.45% of their income. The employer matches it. That's 2.9%. That pays for Part A. That's why Part A is free. At the present rate, if it never changed from 145, you'd still have the hospital coverage, but it would only start paying like 89% and go down from there. However, if they increase the deductions, the trust fund would run for another 75 years. So I don't believe they're going to let that go to the point where 2036 and have that coverage drop. Between now and then, they'll jack up the deductions. This guy was a happy camper. He was the corporate attorney for a large corporation. monumental pain in the ass. I thought I was in a deposition. He asked me question after question after question. But when he got finished, he was a happy camper, a good guy. Now, we're just about at the end, and I don't know if you folks can handle the next slide. You're sitting down? So anybody that got any questions, if you want to follow up with me and you want help in finding a plan for yourself, that apple and orange handout sheet is a way to contact me.
So we do have plenty of time for some questions. So stay right there for a minute. So if anyone has a question that they wanted to ask Russ while we're still have everybody's attention, and it must be a serious question.
No, it's a serious question. Russ, you said about if your health deteriorates or circumstances change, you can change to the orange plan anytime. My understanding from, because I've already signed up for Medicare and that's what I do now. I thought the window was you could only do it in October or something.
All right, that has to do with election periods. The initial election period is the 7 months before, during, and after your 65th birthday. That it can occur at any time. But if you have a plan and you want to switch, you can only switch during the annual election period, which is October 15th to December 7th, to be effective next year.
Thank you. That was a very good question. Anyone else? Yes.
I just moved here. Do I have a certain time period that I can apply?
Yes, you have a special election period.
And what is that?
60 days.
Okay, thank you.
60 days. So the clock's ticking. You got.
Don't go to the Worcester Social Security office.
Don't go to Worcester.
So, Russ, if folks hear, sometimes you have to hear this information multiple times before it sinks in, as you know. If someone wanted to meet with you or have a phone call with you to talk about specifics, would they contact you from the information on that sheet, the handout that you had, and tell you how you usually manage that?
Yes, you can call me or send me an email. But what we do, we just have an initial 4 or 5 minute phone chat to figure out where you are and where you might be headed. And then if you wanted to go further, depending on what plan you might want to go to, like with the Apple, I need a list of your doctors and the medications you take. Because if you're talking about something that has a network, we want to make sure your doctors and medications are in that network.
Very good. Does anyone else have any thoughts or questions, or maybe a situation that you want to run by Russ?
My husband and I signed up a couple of years ago, and we had somebody come to the house like you. Somebody I had met networking before I met you, obviously. This was a few years ago, but so we're doing what your wife is doing. So yeah, it's Fallon Orange. See, I thought that Medicare paid first, but it isn't. The HMO pays first, and then Medicare pays.
No, Medicare is not in the game at all with the Apple. It's only in the game with the orange. Got nothing to do with the Apple.
So Medicare pays nothing with the Apple?
Well, Medicare subsidizes that insurance company to the tune of $1,100 a month.
Right. That's what I didn't know until you said that.
Yeah, well.
And we've been happy with that, with the Fallon Orange, because it's all co-pays, and we were paying co-pays before, but we never go to the doctor. It's very rare, so we didn't want to pay every month if we didn't need to, you know.
Right. But if somebody is over 65 and still working and covered by their group health plan, they will most likely get a better shake by going to Medicare.
Neither one of us are covered by our jobs for any kind of plan, so that's why we did.
Yeah,
what we
but
did.
I'm talking about employees.
Right.
See, a typical employer group health plan might have, for an individual, a premium of like $1,000 a month. That's what the employer pays. Well, that's what the plan costs. The employer might pay 60% of that, or $600 a month. The employee's paying $400 a month. But if that employee switches to Medicare, the employer saves $600 a month times 12, $7,200 a year. And the employer is no longer paying $400 a month. Most likely they're paying $185 a month for the Medicare Part B. And that gives them a savings of $2,500 a year. But in addition to that, they'll no longer have a $2,000 deductible, which most of those plans have. And that $200,000 deductible, the $2,000 deductible equates to $167 a month. So now they've got instead of a $2,500 raise, they got a $4,500 raise. So I try explaining this to corporations, and there's a credibility factor until I show them exactly how it works. Because what I say to them is, how would you like to save money and give your employees a raise? That's the bottom line.
Anyone else have another thought or question?
So just to kind of like summarize that, what you're saying is that most, if you're 65 and you're still working, you'll get a better shake if you sign up for Medicare than staying on your employer's plan. Potentially.
Mostly yes, but some employees have a dinosaur for the employer where they're picking up the whole tab.
I see. Sure. Right.
And it all depends what they're paying out of that, like $1,000 a month.
Right.
If the employer is paying 75%, they're only going to save $800 a year. But if they have that $2,000 deductible, now they're saving $2,800 a year.
Right. Okay.
So it's different folks, but different strokes for different folks, but just about all the time, it's a better shake for them to understand how both benefit if the employee decides to move on to the plan.
Mm-hmm.
The employer can't bribe them, offer them incentives or anything. But you got employees turning 65, you can give them this education, and then the employee themselves can say, hey, Russ, can I do that on the plan? I say, sure. But the employer isn't pushing it, isn't stimulating or doing anything. They're just putting information in front of them.
Sure. So not cajoling them, or they're just giving them the information. Here's the information. You make a choice. So that's...
Yeah, if they cajole the plan, they could get slammed with the Medicare secondary payment rules, which are extensive.
I see. Okay. All right. So that's important information to know. So, well, great. This has been very good. Okay. No, the clicker.
The clicker.
You can keep the mic for a minute.
Testing 1, 2, 3.
Let's give Russ another round of applause. And Russ, we really do appreciate you coming, and we know that we know you had surgery earlier this year, and we were on pins and needles last month. Is Russ gonna make it? But we knew you were a trooper, and we knew you wouldn't let us down, and you didn't. And that...
No, but you don't know what I had to go through to get a ride here for today. And my son found this young lady. I mean, I drive, I do everything, but I have to, somebody's got to fold up the walker and so forth and listen to my blathering on the road.
She can give the presentation next time because she's probably seen it 9 times already. But thanks for bringing him. We appreciate that. So just as a reminder, next month we're going to be back here on the 10th, the second Wednesday of the month. Senior-friendly exercise, safe and effective workouts for older adults. And we have a couple of folks coming with us. They were with us last year. And it should be a great seminar. Then in October, we've done this seminar last year, decluttering and downsizing, navigating the journey of letting go. We're going to do that again because we think it's important information and new people can glean some new insights about that as well. So Russ will be around a little while afterwards. We have the room till noon, and we hope to see you again next month. So everybody have a great, one more thing. There's basil and there is mint on the back table. We have an abundance of basil and mint at our house. So we were gone for about a week and we came back and the basil is like overflowing. So please help yourself to some basil, help yourself to some mint, and enjoy it. So thanks for coming.